Good morning from the Capitol. I've had many people reach out asking me about my priorities for the year in terms of legislation I'm carrying, what I'm going to be focused on. And I thought I'd just provide a quick update on the three priorities I have. I've got pieces of legislation, but multiple pieces of legislation, but I've got really three priorities that I'm focusing on. Number one is what we can do to address the CMS mandate for us from a state perspective, from a state level. The federal mandate is egregious. It's unconstitutional. Most have been struck down. Supreme Court has spoke regarding OSHA, but we still got the CMS mandate, which is absurd. We've got frontline healthcare workers that have served Tennesseans in our community so well for 2 years. And for a year, they worked with no vaccine, no option of a vaccine. Now we're a year in. Many of them already have natural immunity, have religious reasons why, or medical reasons why they don't want to or can't take the vaccine. Some of those exemption requests are being denied, even when the CMS mandate provides for an option for those to be granted. And we find ourselves in a position where we're approaching a date in mid-February that healthcare workers have to be vaccinated or they lose their job. Makes no sense. This is not science. This is not listening to the experts. Again, limits to what we can do, but there are a couple action steps we can take on the state level. I've got legislation drafted, ready to roll, and I'll present that next week. I've gotten great feedback from our speaker, from Lieutenant Governor. I've talked to the governor's office. I think we're going to be able to gain some traction there to protect our healthcare workers and ultimately ensure Tennesseans receive the highest quality of healthcare they can possibly receive, because so many of our medical institutions, our medical facilities are beyond a crisis point. I've had a couple of administrators tell me it's beyond crisis. They've moved into the critical phase of being able to provide quality care to the community because the medical staff has been so overworked. So many have left. They can't afford to lose anybody else. And so the federal government obviously doesn't understand that, but we got to step in as a state and take action. We're going to do that. Number two is big tech censorship. Significant issue. I personally have been censored by YouTube presenting a bill in your state capital. Many others have. It's typically just conservative voices, unfortunately. And again, Section 230 in the federal law limits what can be done, but there are certain steps that states can take. And so I've got legislation being drafted now to be able to look at that. And then finally, and something that's extremely important to all of us, is in election integrity. Here's the good news. Heritage sent out their score of all 50 states. Tennessee ranked third in election integrity in terms of the best states for elections. In election integrity, Tennessee is third. Always room to improve. And so based on the events of our last presidential election, November of 2020, states such as Georgia, Pennsylvania, Wisconsin, where those who are not the state legislature stepped in and either amended law or circumvented the law outside the bounds of the Constitution. Steps that we can take legislatively here in Tennessee to ensure that never happens, to reinforce the Constitution that's already there. There's steps we can take. So I'm going to be focused on election integrity and have a bill being drafted now ready to address that. So those are the three priorities. Again, I have multiple pieces of legislation, but those are the three that I know would be of the most interest to you. So we'll probably start presenting, I would say, my first bill related to the CMS mandate. It's going to have to roll next week because we got to push that through quickly to protect our frontline workers. But want to give you an update. If you got further questions, feel free to email me. Just know during session, sometimes the response can be a little slower than normal because some days we get hundreds and hundreds of emails. But if I can serve you, if I can help you, let us know. Call us at 615-741-2264 or shoot me an email, shoot Janice an email, and we'll help you any way we can. Thanks. Have a great day.